Hello and welcome back. This is Amir Lahiji live from Los Angeles. Good morning, good afternoon, maybe uh, good evening. Wherever you are, my hope is for everyone to have a healthy and stable life. So, to have a stable life, we need to have a good sleep, right? Let's see who is here. Hello, Dr. Mitra Khorramshadi. Welcome back.
Hello, how are you?
I'm good, thank you. How are you?
Oh, very well, thanks for asking.
So, why we need sleep? And tell me about the stage of sleep.
Sure. Basically, every creature, every animals need to sleep because, as you know, that we do have the different type of, CNS or central nervous system. I already speak about, basement of the central nervous system, which is the midbrain, and then I talk about the mesolimbic system, and I talk about the cortical parts of the brain. So we do have the first floor, second floor, and then, at the top and third floor, which is the cortex of our brain. And
Mm-hmm.
we have to know that the cortex or prefrontal cortex is the most important part of the body that are planning our executive functioning, working with a lot of planning and reasoning in our daily life. And for functioning in this manner, we need to have a good sleep because the sleep, believe it or not, is kind of like a housekeeping. When you are sleeping, all of the toxin is going on, all of the neurons and the wires get rest and nutrition, and then they do have better quality of the performances for the next day. You probably experiences that when you didn't sleep last night well, you do have the foggy brain, you do have
Mm-hmm.
irritated mood, you do have the anxiety, or probably it's not a good day at all for you from the beginning up to ending. So yeah, sleep is very important. It's a very essential for our body and our brain. As we need the food, we need the sleep, and as we need the food and the sleep, we need the music. So I believe that these are not separable. And as much as the human being get sophisticated and advanced in the matter of the knowledge, they understand that the quality of the sleep matter in the quality of the life. But let's talk about the different stage of the sleep. Two
Yeah.
category, two different stage of the sleep, which we call it as a non-REM and REM. Non-REM means non-rapid eye movement, and REM means rapid eye movement. So let's get back to the non-REM. Non-REM is going to be divided in two or three different stages, maximum, three stages. Um, it's going to be non-REM 1, non-REM 2, non-REM 3. In non-REM 1, we kind of, sleepy, drowsy, and we have a very light sleep. In non-REM 2, the sleep profound a little bit deeper. And then in the non-REM 3, we do have the deeper and deeper sleep. But what's going to happen in REM? REM is the stage of the sleep that we have dream. We do
Mm-hmm.
have the different type of the dream. And I have to tell you that, majority of the time we do have the, a sleep problem that associated with the non-REM or REM, especially for the elderly that they are struggling with the depression. They have problem with the REM stage of the disease. And a lot of, people under taking antidepressant, antipsychotic medication, there is a little bit differences between the REM for the normal individual and the people that are under the, different type of the medication, especially antipsychotic and antidepressants medications.
Okay, amazing. So, do you want to talk more about REM?
Sure. There is a type of a stage of the sleep. We call it as a REM. As I said that this is a rapid eye movement, and in rapid eye movement means that all parts of the body is a kind of or muscles. I mean it's a paralyzed. So your body is a kind of paralyzed, but blood pressure goes down and the heart rate goes down, and everything's trying to get the relaxation stage for the REM. So that's why the brain activity goes high, and we do have the dream and many type of problems such as night terror, nightmares. All this comes to the REM stage, and by finding out all the waves that are released during the sleep, we can figure it out what type of the disease and what type of the stage associated with this type of the disease in this group of people.
Okay, and what does affect our sleep, and the sleep hygiene?
Interesting. Yes. First of all, we have to know that we should listen to our body. It means that whenever you get tired, don't um, push the rush on your body, getting a cup of coffee or tea and say, I have to continue. I have to continue. If there is a possibility to take a rest, at least 5 to 10 minutes, close your eyes and at least do a very light meditation, because light meditation brings up the theta waves, which is very important as we do have in a very profound sleep that really energize us and bring back all of the level of the energy that we need for the continuing of the daily life. So your question was regarding the different
The sleep.
type of
This,
the sleep and sleep problem.
yeah.
And I have to tell you that many type of the nightmares, night terrors that especially the young children or teenager are dealing with, that are associated with this stage of the disease, and with sleep programming and videotaping of the patient in sleep, we will figure it out that what stage of the disease is the one that associated with the problem, and how we can help to get rid of this type of a problem. But about the sleep hygiene, we should know that we need a quiet area. We need a dark area. Why I'm talking about the dark area, because melatonin is a kind of substance that's associated with the sleep pattern. And as you know that the melatonin is a kind of dark pigmentation, and darkness cause better sleep and better maintenance of the sleep, not just going to the sleep, but be able to maintain the sleep. So that's why the melatonin as a one type of the pigmentation, it's very important, associated with the pineal gland, that help us to have a better sleep. Another factor that we have to think about it is the level of the noise. It's better to have a very quiet room. If there is a clock in your room that tick 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 that is making noise and makes you nervous, it's better to put it away. Or if there any partner that cause snoring or any type of problem, especially in the sound problem, it's better to have a separate room if it is possible for the people. But I'm trying to tell you that having a good sleep is really matter for the next day function. So if you do have one night broken sleep, or less sleep, you can manage it. But next day and next day and next day, keep continuing. Finally, you're gonna get agitated, irritated, and you will move towards a lot of mood disability and irritability.
Yes, amazing. Absolutely, you're absolutely right. So, Dr. Khorramshadi, how much is a good amount of sleep?
Beautiful question. It depends on in what population we are talking about. If we are talking about the neonates, they need at least 14 hours to 16 hours of sleep in a day.
Wow.
So if we are talking, if we are talking for the children, they need 9 to 10 hours of sleep a day. But when we get a little bit elder, we are adult and we do have the hectic lifestyle. At least we need 6 to 7 hours. But how about elderly? When we get absolutely age, we need at least 5 to 6 hours of sleep. So it depends on which population are you talking about, and it depends on what type of performances or jobs that you are acting.
Okay, so let's talk about a sleep disorder.
Sure. We do have the different type of the sleep disorder, as We call it parasomnia.
Mm-hmm.
Parasomnia or sleepwalking is one of the most important type of the sleep disorder that majority of the teenage or kids are, struggling with that. Why it is very important? Because at the time that the patient is walking, he or she is not aware about the type of, behavior that they are prone to do it. So sometimes they are getting out of the house, they are getting into the, trouble, car accidents, or they do have the, high risk behavior to fall off from, any type of the attitude. So basically, because of the secondary damage or secondary physical damage that they are prone to have, it's very important to recognize and have a nice and helpful treatment for this group of the people. But we have to know that parasomnia,
Mm-hmm.
it's not a real and serious matter that is going to happen forever for person. So if we do have the enough knowledge to diagnose it and make a treatment at the time, we can get rid of it.
So, how their brain works? Their brain, they're aware. Uh, uh, Tell me about the how much their brain is awake or not.
Well, actually, they are in a deep sleep. No, they are
Really?
in a deep, deep sleep. Yes, yes, they are
But
deep
they're
in deep sleep.
walking.
But they
Okay.
are walking and they are doing and performing a lot of activities. And even though if you call them, if you shake them and ask them to stop, they are not aware to respond back to you. So that's why in the type of the sleepwalking, we have to be very careful about the safety of the teenager or children, that they are not aware about what they are doing or manifesting at the time that they are in a deep sleep. When we are taking of the EEG and of this group of the people, we find out they are in theta wave, which is the very deep part of the sleep. It means that they are not able to get up easily, and they cannot remember or recall what was going on at the time that they were sleepwalking.
So, uh, sleepwalking is interesting for me now, because you said they are in a deep, deep sleep. So, and still they have some, functions like walking. So, uh, in neuroscience or as a, psychiatrist, how you can help them?
We don't have 100%. No, we don't have 100% accurate theory or high what's going on with the brain at the time. So no, we don't have that much information. We don't have that much knowledge at this point. But
Wow.
since they are working on the map of brain, they were trying to figure it out what parts of the brain is really involving in this type of disorders.
Okay. And do you want to talk about the another sleep disorder?
I don't know which one is much more, under your, talk about the, sleep terror. And I should tell you that, majority of the children,
Uh-huh.
they do have the feeling that they are so scared, they sweat, they palpitated, the level of the heart rate goes up, and they do have the real nightmare at the time that they are seeing and weaving this type of, images and pictures. But at the time that we are waking up them, or they scream and wake up, they do not remember that what was going on. And that's why the sleep is the kind of manifesting so creepy and secret stuff there, that still we are not aware about the whole mechanism, how, and I mean, what is the association with this type of, with this mechanism. So, yeah, it's,
Okay. Doctor Mitra, what we can do to have a better sleep?
first of all, we have to have understanding that, where we have to sleep and how we have to sleep. And I mean, I have to tell you that, the bed is only just for the sleep and just for the sex. So if you don't want to sleep, don't go to the bed. Don't go to the bed and watch the TV. Don't go to the bed and, play with your laptop, or don't go to the bed and, read a book. You have to be in the other location for this type of, activities and behavior. So basically, the sex and the sleeping is the only, activity that we usually have to use the bed for the, this type of the performances. So if your body thinks that I can sit down and sitting in a chair and sleeping, taking a, daily nap, and then you expected that when you are going to the bed at the night time, you feel that, okay, why my body is not responding, why my body is not, going through the, sleep, because of the, misinformation that your body getting from the environment. So it's a kind of, tricky environment for the for any individual to understand that, just having a sleep in a bed, not in a chair, and not doing the other activities that are not associated to bed and bedroom when we are doing our daily life.
Okay, tell us about brain function when we sleep in the different area, not just not in the bed.
Imagine that, you are traveling from one part of, world to another part of the world. You do have a clock, it's the internal clock in your brain that we call it as a circadian rhythm. Circadian rhythm is helping you or trying to tell you that what time go to sleep and what time get up from the sleep. So circadian rhythm is, look like a fixed clock, your alarm clock that, every single day trying to wake you up in a, at least in a range. I'm not saying exactly at 6 o'clock you're going to get up with the circadian rhythm, but 5:45 or probably 6:10. This is the maximum or the range that your circadian rhythm, when you get used to it in the early morning, will help you to get up. But imagine that you are traveling from one part of the world to another part of the world. So what's going to happen? Your internal clock will not change 100% at a short period of time, as long as you are traveling from one side of the world to another side of the world with the long different clockwise time zone. So your clock, your internal clock, is working as a previous schedule. So what's going to happen if you're sleeping at the 9 p.m.? Still, you want to sleep at the 9 p.m., but probably other part of the world is in the middle of the day, and that's why it's going to take 3 to 4 days for your internal clock to be able to recognize that where are you and what is the environment and what is the external stimuli that you're receiving, to be able to update himself or herself to the new position.
Okay, so but we are talking about the location. When someone trying to sleep in the different area, couch, in the car, bed, how affecting our brain. However, you mentioned about bed is just for sex and sleep. I'm disagree about the sex, because lots of people, they love to have a sex in a different location. Is lots of fantasy, and it's okay. But maybe kitchen is not good for sleeping.
What are you saying? I understand, but this is the standard. So
Yes.
we do have the different variation. We can move from one sort of or one type of behavior to another type. But if we are looking for the standard form of the behavior, so that's why I'm saying that the bed is a type of location for the sleep and the sex. Yeah, I understand that as especially for teenage, it doesn't matter where you are, how you are. When they are engaged in the sexual activity, they will, go and, do the sexual activity. But regarding that, how your brain is going to be misunderstood this external stimuli and how your body responds to the different stimuli that your body get it from the environment. I have to tell you that when your body is not comfortable, you are sitting in a chair and you want to have a nap. You want to, take a couple of minutes as a nap. So your body doesn't have the posture that all of the muscle get relaxed. So you just imagine that, your legs is just down and your hands is up, is not in a horizontal level. Why we need the horizontal level? Because the maximum effort of the heart at that time would be minimum. So that's why when you are sleeping, every part of the body needs to take a rest, need to have a minimum activity. I understand that you can sit and sleep, but believe in me, the rest of the body parts of yours is not taking the maximum efficacy and efficiency of the rest.
Amazing. Thank you so much. I hope everyone learned something to have a better sleep, because it's very important for our body, for our brain. I hope to see you next time with the next topic. Thank you so much. So let's have I have a suggestion. Please send this video to your friends and family, because lots of people they have a problem with their sleeping. Yeah, absolutely. Stay in touch. We have more things is coming.